Hi guys, Iron Ramsey here, and today we're talking about elbow tendonitis and the sport of metal detecting. One, how to prevent it while you're out in the field detecting, or at least try to. And second, what can you do about it once you have it, because it is an awful thing to have. It really, really can reduce the quality of life while you're out in the field detecting and at home as well. So the first thing we're going to talk about is the two types of tendonitis in the elbow that we can actually get. Tennis elbow is the most common, and that's the one that we develop in the sport of metal detecting, more than likely. Hopefully you don't get it, but if you do get it, it's going to be tennis elbow. We're going to, for the sake of our sport, call this digger's elbow. So if you've ever experienced digger's elbow, I hope that I can help you prevent it in the future and maybe get you on a track to heal faster. So tennis elbow or digger's elbow happens on the outside edge of the elbow. The other type of tendonitis that we can get is called golfer's elbow, and that's the medial aspect of the elbow. We're concerned more with the lateral or outside aspect of the elbow. And what is tendonitis? Tendonitis is where that tendon that either attaches the tricep or bicep connects to the elbow and allows our elbow to bend, or it operates in the function of the movement of the elbow. Now, there is another thing that can happen if you develop a chronic tendonitis and that tendon becomes inflamed, it becomes thicker. Well, then it begins rubbing against the covering of the bone. That's called the periosteum. The actual covering of the bone can become inflamed because you have this swollen tendon rubbing against that covering of the bone. So now we have two types of inflammation going on in the elbow. Not only do you have tendonitis, but you have inflammation of the periosteum or covering of the bone. And that's a big old mess in there. And it sure can cause you a lot of pain and discomfort just going about your daily life. So let's talk about what can we do to reduce the chance of getting tendonitis while we're out in the field detecting. And the first thing we're going to do is look at our machine. I have White's DFX, and just to speak up for the ladies out there, metal detecting has primarily been a man's sport. Watch out, men. Move on over, because us women are taking over. So machines are primarily designed for the build of a man, and maybe we can talk to some of the manufacturers about that, because it would be nice if they would actually add some different holes for adjusting the height of the stem and the height of the arm cuff. So on my machine, what I want to make sure of is that I want to have the height of my cuff as low as it will go, so when I have it on my arm, I'm sure that it's below my elbow. Okay? I want to have it as low as it'll go. That's what works for me. So I adjust that here, have a little pin, as low as it will go. Now, as far as the stem, this is the most important part. The stem is very, very important, because you know when we're detecting, we always want to get low and slow. That's the way to go. We always want to get low, within an inch from the ground with our coil. Well, if we don't have our stem adjusted correctly for full extension of the elbow, because that's where we want to be, positioned at full extension, then in order to get that inch off the ground, I have to bend my elbow. Now, if I keep my elbow in a constant state of partial flexion, it's going to keep constant tension on that tendon from the tricep and the bicep tendon. Now, if I keep that position for hours upon hours while I'm detecting, at the end of the day, that tendon is going to become aggravated and inflamed and swell. So, we want to adjust the height of the stem up and down. It's going to allow you full extension of the elbow and keep your coil the distance off the ground that you would like to keep your coil. I like it an inch. So I have my machine set to where I'm an inch off the ground here, and my elbow's at full extension. So when I swing my machine, I'm very, very, very lightly gripping the handle. I don't have a death grip on it, and that's another thing. If you keep a death grip on the handle of your machine, we're activating the tendons in the elbow joint, because that's what we have to do to lift things. So you actually want full extension of the elbow. You want your stem adjusted so you can get the height of the coil where you want it with full extension of the elbow. when you swing, as opposed to swinging from the elbow, we'll want to swing from the hip, right? When I swing from the hip, I'll rest the box on my hip, and I'm swinging from the hip, and I have what I call a teacup grip on the handle of the detector, just gently holding it with my pinky up and out, just to remind me I don't want a death grip on that. That'll cause tendonitis in the elbow as well. All right, so those are two things you can do with your machine. You're going to have to experiment with it. If you're brave enough, if you do not have an adjustment on your stem that allows you to get the correct adjustment to keep your arm at full extension and your coil where you want it, maybe take it to a machine shop. Do not do this at home on your own, on your $1,100 or $2,000 machine, please. Take it to a machine shop and see if they can put you another hole in there so that you can get your stem adjusted to the correct height and prevent injury. So those are the two things that we can do with our machine. Here's a third thing that you can do with your machine. You can actually place a strap on your machine. We'll take some of the weight off of your arm and put it onto your shoulder. This happened to be a strap for my saddlebags for my bike, and I saw it and I said, well, I wonder if that would work, and lo and behold, it did. So I just simply took this strap. Now, I've seen a video on YouTube where the gentleman uses a dog leash and connects it to the handle, and that works as well. So check and see in your closet if you have a luggage handle. Oftentimes we have those laying around. So what I did was I just snapped it into my sleeve here, and this one's nice because it's padded already, right? So I can simply place that over my shoulder here, and here my coil is 1 inch off the ground. I'm not even holding it, so I can adjust the straps here. So that takes a lot of tension off of my arm and my shoulder here. So that will take some getting used to for me, because I'm in and out of my machine frequently when I get down to dig. So think about a harness or a strap. They do sell these at your vendors who sell metal detectors. You can look online. I'm going to give a shout out to Calico, because I know those guys here in Orlando. They're great guys. I think Calico has a harness. Check their website. Okay, so we've talked about what we can do in the field. We've talked about the types of tendonitis that you can get. But what if you already have it? All right, if you already have it, I feel for you, because I've had it and I know it hurts. If you walk a mile into the woods, you got to walk a mile to get out. Yes. Can we speed up the recovery of tendonitis? Absolutely. If you're going to bed at night and waking up and going detecting and hoping and praying that it's just going to go away, it's not. So you have to put the work into it if you want to get rid of it. All right, so here are the things that you can do. If you have tendonitis already, all right, make sure also that you check with your doctor. Any kind of injury, you want to see a physician, okay? You want to see a qualified physician or an orthopod that can diagnose you with whatever problem is going on. Never just assume you have tendonitis or assume that something's going on. It's good to get a medical professional's diagnosis before you go about treating yourself. But if you have been diagnosed with tendonitis, here's what you can do at home on a daily basis. This is not hit or miss. This has to be done on a daily basis. And what I recommend is that the first thing in the morning before you get going about your day is to take a little bit of time, set the alarm clock, and wake up just a little bit earlier. The first thing that you want to do is you want to get an ice pack. One of these gel packs from the pharmacy is nice. This one came with a little cloth cover. So we're going to, at this point, alternate ice and heat if you have existing tendonitis and it's not a new injury. Okay, what is the ice going to do? The ice is going to reduce the inflammation in the tendon and the covering of the bone, or that periosteum. So I'm simply going to relax, have my morning cup of coffee, and read my newspaper or Treasure magazine, or go over everybody's finds, or catch up on my Facebook. I'm going to let that sit there for about 15 minutes, exactly 15 minutes. Set a timer. All right, so I've iced for 15 minutes. I'm going to remove that I'm going to take a damp, wet towel and put it in the microwave, 2, 3, 4 minutes. It's nice and hot. Make sure that it's not so hot that it burns you or scorches you. Then after that, now I have the inflammation down because that's what I've done with the ice. I want to open up the blood flow to that ligament and tendon to get blood flow in there so that we can repair any damage or injury. So now I'm going to take that hot towel, I'm going to lay it on there, and I'm going to stay there and finish my cup of coffee until the towel's no longer hot and it becomes warm. All right, so ideally, if you can do that 3 times a day. Now remember, never ice any longer than 15 minutes. But past 15 minutes, you're not doing your body any good, and you're even really actually causing damage. So 15 minutes of ice, hot compress to get blood flow to the area, and that's going to encourage healing. And do that about 3 times a day. Now you can also ask your doctor about anti-inflammatories and see if your doctor recommends taking an anti-inflammatory 2 times a day, maybe in the morning and maybe at night. But you need to ask your medical professional about that because I'm not qualified to tell you to take any medications here. So those are the things that you can do in the field to prevent tendonitis from occurring and what we can do after we get it. But as far as getting rid of it, you have to do the work. You have to do the work. It took hours and hours to develop tendonitis. It's going to take some time to get rid of it. So if you're willing to put the work in, I promise you'll be faster on your way to healing. And so I hope you guys have a great day out there, and y'all keep digging.